Good morning, all. Am I audible? Great. Good morning. We are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to a great master, Prafull Vijayakar, for this wonderful divine science given gift as to all, and taught us there to be wise. We take the blessings of our Guru, Prafull Vijayakar sirs, who have bring this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay Karayana. So, friends, we are in the journey of reading Organon of Medicine, 6th edition, Samuel Hahnemann, along with the reading of the book Theory of Acutes from Dr. Prafull Vijayakar sir. So, up till now, we have understood the basic concept of theory of acutes, as well as in Organon of Medicine, we have completed the theory part from aphorism number 1 to 70, and then the practical part from 71. So up till now we have understood what is the disease and its miasm. Then we have understood the case taking part of Master Hahnemann's guidance, and then we are starting with the understanding of the medicinal part. So in medicinal part, what Master Hahnemann is said is that I am the first one to open up the path of understanding the pathogenetic power of drug by proving itself on the healthy persons, and we are reading the part of the proving. So what to be conducted in the proving? So we are continuing with the aphorism number 126. The person who is proving the medicine must be preeminently trustworthy and conscientious, and during the whole time of experiment, avoid all over exertions of the mind and the body, all sort of dissipations and disturbing passions. He should have no urgent business to distract his attention. He must devote himself to careful self-observation and not be disturbed while so engaged. His, his body must be in what is for him a good state of health, and he must possess sufficient amount of intelligence to be able to express and describe his sensation in accurate terms. So what Master Hahnemann is giving you idea that when you are doing a medicines on a person, so what type of person you are choosing to them? So for that you need to understand, you need to choose the person who is trustworthy and conscientious, who is very devoted to himself for the careful self-observation and have a intelligence, so that he can give you a right sensations and his change in his dispositions or change in the form of the health, so that we can get the pure picture from the drug. And in aphorism number 127, what he said that the medicine must be tested on both males and females in order that also to reveal the alterations of the health they produce in the sexual sphere. So this is also, we all know that it has to be proved on the healthy man, it has to be proved on the male and female, it has to be proved on all ages also, so that we can understand that the proving or the pathogenetic effect of the medicine could be ascertained at particular sphere of action, either in a male or a female. So this is the basic wisdom of Master Hahnemann with all of us. So we will continue our journey of a theory of acutes. So in theory of acutes, it is not nothing different than the other, but what Dr. Vijayakar has proposed that we have to apply our cardinal principle in acute conditions so that we can treat the patients efficaciously and judiciously with a rapid permanent restorations into the health. So that in theory of acute, up till now we have learned the understanding of the man at the perspective of the components of activity, thermal, thirst, and the mind and body dispositions X. As in the conclusive chapter of this book, in which it was written that we are considering the man as a whole as a Panch Mahabhuta. So the activity represent the ether part of our body, the thermal represent the fire part of the body, the thirst represent the water part of the body, the mind and the disposition represent the air part of the body, and the earth represent the physical part of the body. So we are considering all these as a man. So that is what Dr. Prafull Vijayakar sir has proposed, this the theory of acute. So, in this theory of acute, we have understood the golden rules of minimum prescriptions and everything. Along with this, we have understood certain advices to the doctors as well as certain advices to the patients. So, Sir has beautifully designed this chart as a theory of acute. This was the chart. So, this chart is divided into three categories based on the activity, and that is what the activity decrease, activity increase, and there is no change in the activity. So you all have this chart, as I already shared this chart in the group so that you can look at the chart. So I advise all of the doctors to print out this chart so that and put it on your table so that you can remember this very easily and you have a very handy materia medica and handy remedy whenever the patient comes to you in acute conditions. So we are starting with process of understanding the materia medica part and what are the acute symptoms you can think of when the patient comes to you in a this state. So that when this patient comes to you in this state, like the activity has been drastically decreased to the sleepiness, more sleepiness, so that you can just pick up certain symptoms from the patient and prescribe it's an easy methodology. So we are starting with this. So the third part of second part already we have learned the third part of the hint regarding this book. So in that we have seen day before yesterday we have learned about the understanding of the few tips that is handy tips when the acute patient comes to you. So now the third part start with the understanding of the activity. So in activity, we have to understand the activity either a decrease or an increase or a no change. So we are starting with this process. So first part is the activity decrease, but before starting that, we have to understand these questionnaires also. So the in acute case history, what is to be taken into consideration based on Dr. Prafull Vijayakar chart of acute. So first of all, you need to find out this one liner. So this liner will help you to understand that you need to find out this only. So the first you have to find out the activity, then you have to find out the thermal, then you have to find out the thrust, then you have to understand the person is diligent or non-diligent, then you have a PQRS, PQRS either in the form of a mind or either in the form of a body, and then the change dispositions after the acute condition. So if you have get these things in acute conditions, your case taking is over and you will get handy remedy when you have this symptomatology in your hand. So what is the activity means? The activity means that the act is the primary reflections of the life or a living being. So life means change. Anything in this world which does not change at all is called as death. So hence act or actions represent the life and the speed and the type of actions are specific for the specific concept. So we all know that the Wolkeria patients comes to us is represent us with the slow speed of activity, whereas the Naxomica patient comes to us is represent the fast speed of action. So this is what we have to understand in this. So whenever the questions for confirmations about the activity. So today I am dealing with you with the three, four presentations along with so that you can get the idea that how we have to understand the patient. So uh, to understand the activity of the patients, we need to have something in our mind and think and ask ourselves and also ask the patient and observe the patient's activity. So this is what you have to cultivate in your practice. So first and foremost, the question for the confirmation of the activity. So you need to ask a few questions. So these are the few questions that how is the patient with the illness. So this is what uh, you have to ask what happened before, what happened after, and what was the change in you after the illness has been started. So this is what something that the activity will guide you that सुबह से बुखार आ रहा है आज मैं ऑफिस नहीं गया मुझे अच्छा नहीं लग रहा आई फील लिटिल बिट डल I cannot concentrate on my things or something. Patient is telling many things, but you need to judge that how the patient's activity is. So we have to generalize it that the activity has been increased or activity has been decreased in the patient or there is no change in the activity. So this is what we have to keep in mind. So how is the patient with the illness? This was the first question. So you need to think yourself and you need to observe the patient when the patient comes to you. Second point that is the day-to-day activity of the patient affected with the illness or it is the same or his activity has increased considerably. So this is very important aspect of understanding that जनरली तो ऐसा होता है कि जब बुखार आता है तो मोस्ट ऑफ पेशेंट हैज डिप्लेटेड एनर्जी बट मेनी अ टाइम सम ऑफ द पेशेंट्स हैविंग increased activity either a mental or either a physical activity so सर आज तो मैं बहुत जल्दी उठ गया आज मेरे को नींद ही नहीं आई मैं जल्दी उठ गया मेरा दिमाग चलता रहता था घूमता रहता था so this is what something the mental activity has been increased in the patient, or sometimes the mental activity represent you with the anxiety, mental activity represent you with the irritability, mental activity represent you with the crankiness, mental activity represent you with the what we called as do not want to give an answer to the persons or everything. So this is what anger. So most of the emotions are there in this case. So you need to observe this in the patient that his day-to-day activity of the patient has been changed or the day-to-day activity remains the same with the illness. The third question, is he sitting or sleeping in a place or is he restless and about? So this guide us that we have to generalize the patient if it's anxiety increase or decrease. So if he is sitting in a place or is sleeping in a place or he want a quite comfortable environment or he want that I need to lie down, I need to sleep, or he wants to be a restless or he is anxious or his legs are moving even though he is lying down but legs are not at settled, so it is restless. So this is what something that you need to observe in the patients that this is something there. So this guide us that the activity of that particular persons during the acute condition has some change along with this. Then the fourth questions which we have to confirm for that is he quiet or is continuously speaking. So this is what also gives us the idea that sometimes the patient having a high fever and patient goes into a state of talking or talk is also a different kind of talk. So we need to understand the talk of that person's his quality of verbal is changing or not. So this is what you have to observe in the patient. If it is changing, so then your category of the remedy from a particular chart is different. So you need to jump to that chart only. So this is something you have to observe. So this is the activity and the type of activity which we have understood from the chart is the three type of the activity along with the force reactions which Dr. Vijayakar is added in the 2009 previously also there, but it is what the updated chart. So we have the updated chart. So activity is a drastically decrease, activity is an increase, or there is no change. Or the fourth one is angry when obliged to answer. So going back to our reading that activity is increase. So we have a three type of activity increase, decrease, or no change. And the fourth one is the angry when obliged to answer. It is the mental reactions of the patient when the patient with the illness. This is what you have to observe. So now starting with the decreased activity, so we have presentations also that so this was the chart. So keep in mind that this chart is giving you an idea that we have to categorize the patient in three change, decrease, increase, or no change. So if the activity has been decreased, so there is a two different version of the person. Is the person is either a sleep overpowering or a person is going to be a dull. If the activity is increased, so there is a physical activity has been increased, mental activity has been increased, or a verbal activity has been increased. And if there is no change in activity, then you have another chart. So this is what you have to keep in mind. So we are starting with the first category that activity is decreased. So the activity decrease is categorized into two, the sleep overpowering and the another one is called as dullness. So what do you mean by a sleep overpowering? So this section constitutes all patients or constitutions which become dull to such an extent that they sleep a lot during acute infection or a fever. So this is very important that you need to understand that the sleepiness has been increased with the acute illness. Mostly the children comes to you and the mother complains that every day my child wakes up at 7 a.m. or 8 a.m. but today morning he cannot wake up and he slept up to 12 noon or we are trying to wake up but you cannot wake up, and even we had not ate something, again we went into sleep. So this is suggesting that his activity of the body has been drastically reduced and he wants more and more sleep, and that is what the sleep is overpowered his senses. So this is the persons when it comes to you, you have to categorize this. The sleep overpowers the all senses. The patient is difficult to arouse, and this should be differentiated clinically from the sleep comatose or coma or unconsciousness. So whenever you are dealing with the acute emergency conditions, the sleep overpowering is something that you can make the patient awake, but when the patient is in a comatose conditions or unconsciousness, you cannot wake up the patient. So this is what you have to differentiate, and the approach in this case is little bit different. So here, unlike or coma, the patient is fully alert when awake. So this is very important. His consciousness is not altered. So sleep overpowering when the patient is awake. So what happens? So this is what the chart beautifully given by the sir, that after the patient is waking up, what are their actions? So this is what very important. If you find the patient is after waking, he becomes so dull and giddy and feel that I don't want to move, I am indolent. So the remedy can be nothing of that. If after waking the child becomes so much so cranky and irritable, the remedy can be hard. And if the child is quick in actions and react, and even in spite of sleep, he can know that by the what sound has come and senses is so much so alert, then the remedy could be the opium. So, what are the questions to be asked when the patient comes to you with the decreased activity? So when the decreased activity, this is the reactions of the patient in the state of the illness where his activity dropped to a considerable level. So it is mainly due to the utilizations of the large amount of the energy providing our system, which we call as ATP, in combating the bacteria, virus, or toxins. So this is what a tremendous amount of activity has been decreased. So these are the questions that we have to assess, that how is the activity of the patients. The patient may sleep, patient may lie, or patient can not communicate, patient becomes quiet, patient becomes what we call as a sleepy whole time. So is patient is able to do his daily activity? Patient says, no, I don't want to go to my office, or I don't want to go to this. So this is what something that is activity has been reduced. Does the patient just lie in a place doing nothing? So sometimes you can think of differentiation, that is what the sleep overpowering and dullness differentiation is there, that the person is what we called as just lie down with the eye open but cannot do anything. This is also dullness, whereas a person with the sleepiness, he have a sound sleep with a closed eye, then it is sleep overpowering. So this is what you have to observe in the patient. So you need to ask such a question to yourself when the patient comes to you. So what he is actually in this. Does he lie down continuously? So since morning he cannot wake up again, he goes to sleep, then again he is in a lie down comfortably. Or this is what you have to observe in the patient. Is the patient working with the same speed and efficiency, or it has decreased? So this has to be questions yourself, as well as you need to observe in the patient so that you can guide, you can understand that this is what you have to. So the sleep overpowering, in a sleep overpowering, this section constitutes that the whole the patient or the constitution will become dull to such an extent that they sleep a lot during acute condition, as rightly said. The patient is difficult to arouse. So what are the questions to confirm this? Is these are questions. Was the patient awake at his regular time? This was another question to ask to mother or the attendant or the patient also. Did the attendant find it difficult to wake the patient for the food, water, or the medicine? So this is very important. Even in hospitalizations, the nurse came and nurse said, "Kaka to suyo gaye છે." That means his activity has been drastically reduced to such an extent that he can sleep more. Even and we have to give a medicine, we have to wake up the uncle. So this is what something that attendant find it difficult to wake up the patient for the food, water, or even medicines. Is the patient able to remain wake up while communicating, or he become very sleepy? So sometimes whenever you are asking the questions and he again goes into sleep. So as we have read in the Arnica that the one answer slowly and again goes into sleep. Even in acid pause also you can think of this. So you have to observe these things, and according to that you have to assess picture and the PQRS of the patient. So is the patient is able to remain awake? So whenever you go to the patient and you ask questions and patient is quickly responding to that, he was so much so sleepy, but when you ask the question, he is quickly responding to your question, he might be the opium personality. So you have to assess this. Is the patient is able to remain awake while communicating, or he become very sleepy? Here you need to be a cautious due to the heaviness of the eyelids and eye remain closed in Gelsemium, which is not because of sleep overpowering. So the differentiating point is that because of heaviness of the eyelid and he cannot open his eyelid, it is not a sleep overpowering. So this is what you have to understand in the case. So coming back to our presentation, that we are here in the activity chart, and the patient is asleep overpowering. So sleep overpowering, we have four remedies. In the old chart it was a three remedy, but in the newer chart it was added the sulfur. So sleep overpowering, the opium, antintart, and homostat, and the sulfur. Now, how to understand this sleep overpowering in each and every person? So this in sleep overpowering, the reactions of the each individual is different to different, and that is what we have to take into consideration. So in after waking, the quick two actions is the opium. This is a keyword, so you have to remember this keyword along with a few pointers. So we are going to read a few pointers so that we can understand this remedy when the patient comes to us in the acute form, how we represent to us. So after waking, the quick two actions, the opium is the reaction quick to X, the antintart reactions is irritable, the non-chemical reaction is too giddy to move, and the sulfur, you know, the sulfur, even though in acute the sulfur is so much so anxious about the health, but he cannot go investigate the things. And along with that sulfur had a hot palm. So you just observe the patient and you have to examine the patient. So if you have a hot palms, then you can think of the sulfur. So the activity decrease to statistical activity at the sleep overpowering, and we are reading the first remedy, that is opium. So what are the pointer to be there in the opium is the axis. So opium is in axis is the sleepy, the sleep plus plus plus, and also there is the hot. So the three pointers. So in this beautiful materia medica, what sir has given idea that you have to keep in a mind certain pointers and pointers to the remedy. If you find these are the three pointers in the patient, then and then you will prescribe that medicine. You will get 70 to 80% cases the result, and you will have a wonderful practice. So this is what key point. So the triangle represent the key point of that particular remedy. So in this case, you have to observe that sleep plus plus plus, that means the sleep overpowering, no complaint and contented. This is the reactions of the person. The opium person when goes into acute state, he cannot complain, he remain contented. So this is what very important. So sometimes you can find that no change and no complaint. So again, we in no change also the sir has put opium into this because no complaint and contentment. There are the magnesiums also there. So magnesium also goes into this state of no complaint and contentedness. So this is what you have to differentiate from the magnesiums. Again, the opium has the classic symptom, that is the constipation. So whenever the any patient accompanied with the constipation, so you can think of opium along with the sleep overpowering and no complaint. So these are the three pointers very indicating of the opium, the sleep difficult to awaken or disturbed by the slightest noise or never complain and found constipated. You know that even a tick tick of the watch or a clock can awake the opium patient. So this is what even the slightest noise can waken up the opium patients. So this is very important. Other indications along with this is a deep, profound slumber during fever or alternately awaken at the slightest noise or a knock at the door. So he was sleeping so deeply, but a slight noise awake her. So this reaction of the quick reaction is reminding of you as a opium in the indications. The it appears contented and complacent and has no complaint at all. So even the opium does not complain at all in acute conditions. Also, he is hot, thirsty, or at times thirstless. Also, there is the obstinate constipations and the reactions when awakened. The reactions is quick to move, turn the head, change the position, etc. Unlike Nux vomica and Nux moscata and Helleborus, they are so lazy and indolent in the bed, so you cannot move it even after a wake up. So this is what you have to differentiate by observing the thing. So opium is like this. So go back to our the same sleep overpowering chapter, that is the we have understood the first remedy, the how opium be present to us with the three pointers, and that three pointers along with the few pointers, additional pointers help us to prescribe the opium. So in this chart, we all know that in this chart, sir has not added ailment into it, but you need to add the ailment if you found into the case. So whenever you found the ailment, and then you need to assess that the activity has been dull, activity has been increased, activity decreased. So it is easy for your differentiation. So whenever I used to apply a Zoomio software, in Zomio software, it was given a acute filters. So I used to take the ailment from and the reaction of the patient. Then I got certain remedy. Then I apply acute filter that activity has been decreased. The patient is hot, patient is thirsty. So I got a certain two, three remedy out of it, and then you have to different. So it is very easy when we have a software handy. So that helps us. Now, if the sleep is overpowering and the person's reaction become irritable after wake up, and what are the another key point to be taken into consideration so we can prescribe antim-tart. So we are reading the antim-tart. So antim-tart is the axis is sleep overpowering, the patient is chilly and thirstless, whereas in opium the patient is hot, it can be thirsty or thirstless plus sleepy. So again, you have to differentiate from this also. Same way, the opium, the having anti-tart has the excessive sleepiness, sleepiness plus. Then along with sleepiness, there is the excess perspiration. So this is what his toxin removal from the body in the form of perspiration has been increased drastically. So whenever you recognize the patient with the a patient is sleeping in a slumber or a patient is sleeping in the deep profound sleep along with there is a perspiration in the body and patient cannot wake up, the patient having a lot of weakness, then you can directly think that the remedy is anti-tart. So the key point of anti-tart is excess weakness, excess perspiration, and excess sleepiness. These are the three key points. Again, we all know that the antim-tart is a remedy for the respiratory complaint. So we know that the respiratory is the seat of actions of antim-tart along with the vagus nerve, pneumogastric nerve. So you all know the pneumonia. I must have a few cases of acute in observations when I have used to prescribe the anti-tart. If you found the child is very irritable with the respiratory complaints and there is a rattling in cough and there is a cough and bronchitis, along with bronchitis, if you found that fan-like motions of Alanazi, so mostly in cases of a pneumonia and pneumonitis. you can directly think of anti-tart along with these key pointers. The person is more sleepy, more perspirations, more weakness with fan-like motion of alanasi plus restlessness or irritable child, and along with that there is we called as a rattling in the chest and the bronchitis or bronchiolitis. So this is what antim-tart is the case. So the other indications of antim-tart is he become irritable mentally, so he become cranky, he become touchy, he cannot aversion to touch, aversion to look at. So these are the symptoms of antim-tart we have seen. And there is a thirstlessness, but sometimes we want a sips of water or one like arsenic. So you have to think like this. Even arsenic has the excess weakness. Okay. And another key point of the Indian tart is child having aversion to milk. So this is what the milk is a primary food for the child, and a child having aversion to milk. Along with this symptom, you can directly think of anti tart. So in a sleep overpowering, we have seen that after waking, the quick to act, the opium after waking, child is so much so irritable and cranky, the anti-tart, and after waking, if we found that the person is unable to move, or too giddy to move, or very dull, then we can think of another remedy that is Oxymostrate. So the axis of Nux moscata is again the sleepy plus chilly plus thirstless. So we have seen the sleepy, chilly, and thirstless, the sleepy, chilly, and thirstless Nux moscata and entim tart. So differentiating point of Nux moscata and entim tart is Nux moscata has more dryness, whereas entim tart has more perspirations and exhalation. So this is what we have to differentiate the remedy side by side when you have a axis. So you all know the sleep overpowering, the sleep plus plus, there is a dryness of the whole mucous membrane. Along with dryness, there is one characteristic as pulsatilla has is thirstlessness with the dry mouth. Pulsatilla has also the same symptom. So this is what you have to keep in mind. The Nux vomica has thirstlessness with the dry mouth. And we all know that Nux vomica is a kind of a hysterical remedy. So in most of time, persons having the complaint, acute complaint with the fainting spell, he goes into a vertigo, he goes into the faintness and everything. So this is what the fainting spell is there in Nux vomica. So sleep overpowering, dryness of the mouth with no thirst, and the fainting spell indicate Nux-Moscata. Along with there is symptoms what Nux-Moscata persons telling you that whenever I used to eat something, everything feels dry in my mouth and no saliva is coming up. So this is what dryness of the mouth causes dry cotton saliva. Along with the dryness of the whole mucous membrane, the stool becomes so much so dry, so excessive drowsiness with neuralgic pain and abdominal pain, the actions, fear of actions of nux vomica act on the nerves as it is a hysterical remedy, and also it is acting on the GI tract. So the patient comes to you with the neuralgic pain, with the excessive drowsiness and dry mouth and panting spell, you can think of nux vomica. And most of the time, the person says that I used to have a vertigo when I got a fever. I used to have a blackout when I got a fever. I used to have a blank out without any reason. So this is what a tendency to the fainting you can think of. That's most. So whenever you have person having a sleep overpowering and the person's having after waking the reactions is different, so that the reactions guide us that how the person is. So the opium is quick to act, the entim-tart is irritable, whereas nux moscata is too giddy to move. And the fourth remedy which goes into sleep overpowering is the sulfur. So in this also we can differentiate the sleep overpowering, the hot remedies, opium and sulfur, the chilly remedies, entim-tart and nux moscata. Sulfur can be thirsty and thirstless both. Opium can be thirsty and thirstless both. Entim-tart and nux vomica both are thirstless. Or entim-tart require a sips of water, so he might be thirsty also. So this is what you have to directly differentiate with the easy understanding that if the person is so much so sleepy, we have a poor remedy, and out of poor remedy, we need to differentiate from the thermal point of view. So these are the few indications. Now the sulfur. So sulfur has a different axis, that is a sleep overpowering axis. The mental anxiety also increase the axis, dull hot thirstless axis, and dull hot thirsty axis. So sulfur can be anywhere. So you have the different axis here, so you can get the sulfur. Now, by looking at the sulfur, you can just prescribe the sulfur, that the sulfur having the orifice, all the orifice of the sulfur having a redness. It is because of the congestions of everywhere. So the lip is bright red. So many a time, whenever the child comes to you with a fever and bright red lip, and he is very dull, or he is sleepy, or having irritable anxiety, he is hot, and he might be thirsty or thirstless, you can directly observe the child. If you have a red lip child, and you have to check the palm of the child. The palm of the child is so hot, soul is so hot, then you can directly prescribe the sulfur. Sulfur having another syphilitic sphere, that is angry with himself. So most of time the sulfur fall ill, he become angry on himself. So this is very important, that why I got fever. So that goes into a mental anxiety also. I do not want to go to the what we call as investigate and everything. So this is what he got angry on himself gradually. Other indications of the sulfur, that he is internally so much so anxious, but bursting open with the anxiety at night at 1 a.m. So this is what, in daytime he was so anxious, but he cannot open up. But at night he becomes so much so anxious. So we can think directly, the at night, midnight, after the anxiety, the remedy can be arsenic also. But it is not arsenic, it is the sulfur. Arsenic is chilly, whereas sulfur is hot. Arsenic is thirstless, sulfur is thirsty. So this is what you have to keep in mind, that how the sulfur present to you. Again, when the sulfur patient becomes ill, he got angry on himself. Most of time, the person become irritable and angry. Sulfur is, all we know that sulfur is the angry remedy. So that anger also represent at the level of blood vessels, and it produces a congestion at the level of lip, and there is a hotness. So this is also the anger represent. So red is hue on the face and red lip. The Boger rightly said there is a red orifice. Red orifice. So every orifice which is red, you can directly think of sulfur. Another important aspect of sulfur, whenever the sulfur patient comes to you, I generally observe many a time in my clinical practice, is the sulfur patient comes to you with the dirty clothes, or he had not bathed in acute conditions, or sometimes the messy hairs. So most of time the messy hair in acute conditions, and the person is dull, hot, thirsty, or thirstless, or a person is anxious, hot, thirstless, or a person in sleep overpowering, hot, and thirsty, then you can directly think of the sulfur. So we have the syphilitic sphere of sulfur, that indifference to external appearance or personal appearance, that is what the sulfur is. So hair is haphazard and dirty appearance and aversion to bath. Anxiety health, yet not ready for any investigation, not even measuring the BP. This is what the clinical understanding that Dr. Vijayakar sir has given to all of us. Many a time we have confirmed it in our practice also. So whenever there is a person having a lot of anxiety, so generally I used to incite the patient in acute, so their original reaction comes to us, and then we can get the idea. So I generally ask the patient that you need to do investigation. So if you do investigation, then you will have an idea that you will have to prescribe certain remedies. So most of time sulfur patients lame excuse that, सर आप दवाई दे दो ना, आपकी दवाई से तो ठीक हो ही जाता है, आपकी दवाई से मैं हर बार ठीक हो जाता हूँ, अभी रिपोर्ट विपोर्ट नहीं करवाना है, नहीं करवाना है, इतना बुखार ठीक हो जाएगा, कोई टेंशन नहीं है. So that was the reaction of the sulfur. Most of time he had a lot of anxiety about the fever and everything, but whenever you are prescribing any investigation, he will directly refuse. Another differentiating point with this sulfur that whenever you ask a first time report, anxiety health about, and you revise the report, and the person directly says, okay, sir, I will do the report and then we will start the medicine. This is what the consensus another remedy is lycopodium. So lycopodium go for investigation because lycopodium has the anticipatory anxiety and a fear that something will happen to me. What will happen to me? So before something will happen, I need to investigate myself and I get better. So this is what the differentiating point from the sulfur and the lycopodium is. So lycopodium can go for the investigation very easily, whereas sulfur cannot. So this is the acute conditions you can think of sulfur. Hope you got a little idea that how we have to differentiate each and every remedy with this chart so that we can understand the remedy in a proper depth. Okay, so coming back to our original chapter that we have deal with one part of our the decrease activity that is the sleep overpowering and another part of the sleep overpowering. In sleep overpowering, we have a core remedy that is opium, entintat, nux moscata, and sulfur. If we apply the thermal axis to these, that the two hot remedy and the two chilly remedy, along with the key pointers of everything, if we apply the thirst filter, then we have thirsty, thirstless remedies are there. So that easy understanding of this activity thermal thirst chart help you to prescribe the remedy in your practice. Hope you enjoy this learning. So in our reading of this, we have sleep overpowering, and these are the three key pointers. We have completed these three pointers. And for remedy relationship, at the end of theory of acute book, we have the remedy relationship of each and every remedy. So whenever you are dealing with a chronic case and suddenly the acute patient comes to you with the dullness and sleepiness, and if you know that is chronic remedy, then go to the remedy relationship chart and find out a certain remedy which is the change disposition right now, and from that you directly easily pick up the remedy. So this is easy homeopathy. So sir has made this for all of us, the easy homeopathy. Now today I will not take a whole dullness chart, but will take a little bit of it in this sessions. Uh, and tomorrow there will be holiday as Sunday. Monday I will take one class, and from Tuesday to Saturday or Tuesday to Saturday I am not available as I am traveling to Delhi for World Homeopathy Day. So we will continue our class from the next week. So Monday there is one class, and then the next Monday we will continue our this class. But today I will take a little part of dullness and we will revise in Monday as well as in the next class also. So what is the activity decrease? So activity decrease. So we have seen that activity is drastically decreased to such an extent that patient goes into sleepiness and slumberness. That is the different story. But in this, the activity is decreased, that patient become the speed of action become reduced, is what we call the energy has been reduced. He becomes so dull, and by looking at your face, so many a time in acute condition, by looking at the face you can judge that the person become dull, his charm, his aura has reduced to certain extent. So this is what you have to observe in the patient. So what is the by dullness? So by dullness it means that the hypoactivity of the mind and the body. So whenever inactive illness occurs, a certain constitutions has reduced in activity. So this reductions in activity is obvious from the fact that this patient would like to lie down or on a bed more than usual. Their voice does not have a jest and vivacity. So again, the voice also give you idea that you become dull. So by observing these things, you can directly reach to certain remedy. and they just rest and the sleep. They may not be in a slumber or may not be in overpowering sleep. So this is what you have to differentiate, that it goes into a sleep overpowering or a dullness. So that will give you a group of remedies. So in dullness, there are many remedy, and out of this 30 remedy, you will get 60% cases of your practice comes from this 30 remedy and you will get the result. So this is very important to understand this chart. So in dullness, we have divided this chart into four categories, that dull, chilly, thirstless, dull, chilly, thirsty, dull, hot, thirstless, and dull, hot, thirsty. So we have to add the filter with the dullness, the filter of the thermal, the chilly, and then another filter of the thirsty or thirstless, so that you will get a different chart. And out of this chart, you have to prescribe. So this 30 remedy in your practice will give you a 60 to 70% result, because many a time person comes to you with this dullness and you will get wonderful result out of it. Most of the patients in an acute condition goes into dullness with the indifference. I used to have a lot of prescriptions of the same in acute, and I got wonderful result. The next day person becomes active. So that is what the sepia is. So we will read each and every remedy from this. So we'll start with this. So what should be think, and what should be the question to be asked whenever you got this type of persons? So as we know that the dullness. So dullness is, we usually think of that the hypoactivity of the mind and the bodies and everything. So what are the questions to be confirmed when the patient having the dullness? So while the patient is lying on the bed, he is a fast asleep or just lying out of weakness or the dullness. So this is what you have to understand. So weakness at the physical level is also a dullness, and not concentrating on something and not his activity or zest or vivacity has been reduced. It is a mental dullness. So you have to think like this. So you have to observe this. If the person is lying on a bed, is going to sleep very easily, or just he is lying due to weakness or dullness, how is the patient is interacting. So whenever you know the patients, in a so if the patient is coming to you in a for a chronic illness and suddenly comes to you in an acute illness, so you have to understand the voice of the patient. You have to understand the interaction of the patient. If the person is interacting in a very dull voice, or if the person interacting in a very low tones and voice, so then you can think that this is something which we call as his activity is drastically reduced. It is called the dullness. And the third point is the patient taking interest in his surrounding or things that would otherwise fascinate him? So most of time in children, you can think that he used to play with toys and everything, but during the fever, he does not like to play with the toys and everything, because this toy and playing is fascinating to him. But in acute conditions, when he does not play with them, so that is what we called as the dullness is. So these are the few questions you can ask yourself and you can get the idea into it. Okay, so go back to our presentations that the activity is divided into three categories: decrease, increase, and no change. And we are dealing with the decrease activity. Up till now, we have completed the sleep overpowering and then the dullness. So now dullness. So if we have a dullness, so we have the filter of the hot and the chilly, and another filter of the thirsty and the thirstless, hot, thirstless, and hot, thirsty. So these are the different filter we have, and out of that we have a certain remedy in our chart. So we are starting with the first chapter of the dullness is dull, chilly, thirstless, and we have 8 9 remedies from this, or 10 remedies from this chart. So we're starting with this. So whenever you find that the person is dull and chilly and thirstless, so you have to think about this are the 4 5 5 5 10 5 or 4 9 remedies of the chart from the chart, and then you can have to prescribe the remedy. So in the first line of what we need to take a case taking is that we need to understand the diligence. The first is axis of the activity, then thermal, then thirst, then I write that it was diligent or non-diligent, then the PQRS, and then the disposition. So if we find that the person is dull, chilly, and thirstless, and if the person is diligent and conscientious, then we have another filter. If the person is non-diligent and non-conscientious, then we have another filter. So that filters gives you idea that you need to prescribe from this five remedy only. This filters gives you idea that you need to prescribe from the four remedy only. So that is what the homeopathy is so easy in our practice. So we are starting with the diligent remedy from this chart so that we can understand non-diligent also. So diligent, we all know about the diligence that in spite of having a fever or in spite of having a illness, the person is working hard and working conscientiously, not because of certain pressures or not because of fear and everything. So many a time in school going children, you will find that during the fever, the child want to study, and that is what the diligence is. So we have a diligent remedy that is the Ignatia, Stephysagria, natrum carb, and acid fast. Acid fast can be given in both chapter diligency as well as non-diligent. So uh, again, this remedy, when you think of this remedy, you need to understand that this diligent remedy are so much so sensitive to certain things, and that sensitivity is got hurt specifically in acute conditions as an ailment, and from that ailment they got ill. So that is very important aspect of understanding. So in ignitia, we can think of ailment from the grief or a hurt or ailment from loss of positions. So it is what we have to understand the ignitia is. So here the sir added a certain mental ailment when you find that a dull, chilly, thirstless and the diligent remedy in front of you when they are suffering from acute illness. Then you need to ask what was the ailment happened before that. So you need to directly prescribe certain remedy on the basis of that. So if the person getting hurt, person getting sad, person getting weeping, and person having ailment from loss of positions and the grief, you can directly think of ignitia. If the person getting so much so angry and he cannot express his anger, and he goes into state of mortifications or indignations or suppress anger, you can directly think of Shakespeare. And if the person is more of sensitive to touch, sensitive to consolation, sensitive to sun, and having aversion to company and aversion to milk, then this is what you need to understand the natrum carb is. Even natrum carb has sensitive to touch, and they also want touch during acute conditions. This is very important. And in the acid fast, the acid fast has the accompanying symptom that is what we called as acid fast is another remedy for the grief, a chronic grief, and also it is hurt. Okay, but that grief goes into a state of weakness, and the weakness to overcome that weakness, he wants some refreshing, juicy things or desired fruits. So this is what in acute condition you can think of this the remedy. So, hope we will continue our learning of this chart from Monday onwards so that we will have a great idea. So, this is what just I have given you a brief of this, and we will continue this in detail from Monday. So, today's we will conclude it here. So this will help you, this understanding will help you in your clinical practice so that will give you a wonderful results in acute conditions. As I already have experienced these things many a times and I got a wonderful result in my practice. So that will help you. So this is what Dr. Vijayakar sir has made this chart very easy and handy, and that's why sir always says homeopathy is mathematics. And if you understand the tables, if you understand the calculations, or if you understand the equations, your mathematics becomes so easy, at the end, homeopathy becomes so easy. So that is what I am sharing with you, the knowledge of Dr. Vijayakar sir with all of you. So I have a benefit. So you also have the benefit from this. And if you got the great result with this acute understanding, please do share your case in the group so that other persons from your experience can learn very easy. Even though a small case of a 5 minutes and you get the result, do share in the group so that other also learn. Sir always says you can learn from the experience and you can learn from the sharing of your knowledge with others. So this is what you have to do. So thank you so much. We conclude today's session here and we'll continue this session on Monday. Tomorrow there is a holiday as I am traveling to Delhi for World Homeopathic Day celebrations. So from Tuesday to Saturday I am not available online in online class, and we will continue our online class from the, I think it was on the 14th on Monday or 15th on Monday. It was on the 15th. 15th of April we will continue this acute journey.
15.
So yeah. So thank you so much. Thank you for joining. Do share your experience of acute in the group so that other can also learn, and even I myself also learn from your cases also. So thank you all. So we call the day off. Thank you.
Thank you, sir.
Thank you.